Good morning, everybody, and welcome. And we're going to talk today about aspirin. And let me get this shrink down here and get the presentation going here. If I can get it clicked here. And here's the thing about aspirin. And there's some folks that maybe don't understand how it works and what we use it for in EMS. And we'll make sure that you guys understand that. And this is also going to be for BLS and ALS applications of this as well. Other names you might hear aspirin as is acetylsalicylic acid, or ASA. Bear, Bufferin are brand names of this. BC powders, Bufferin and caffeine actually that's what that is. And it's an anti-inflammatory. It's an NSAID. But it's a platelet aggregator, and that's why we like to use it, especially for our heart attack patients, because it makes the platelets slick. It makes it to where the platelets don't actually break; they don't form more clots. So it has a very powerful ability to help inhibit further clots from forming. It is an antipyretic, which means again, it does reduce fever. It reduces the inflammatory response to the body as well. Again, NSAID, non-steroidal anti-inflammatory agent. Okay, and in the way that it works basically is it stops the A2, which doesn't allow the platelets to come together, form the little webs, and therefore it reduces the mortality of your AMI. It can also reduce non-fatal reinfarction, and if it is a thrombolytic stroke, it can help in that. However, giving it aspirin to a stroke patient is a little bit on the dangerous side, because if you don't know what type of stroke that they're having, if they're having, again, a thrombolytic stroke, it is very helpful. If it is a bleed and you give them aspirin, you're going to make things worse. And it's really important that you stress that point to people, is just because, again, the bleed percentage is about 7%, but if you give it to the wrong patient, that's bad news, okay? So again, it does increase body temperature, and it does cause a little bit of mild vasodilation. Nothing that's going to drop our blood pressure too bad, but it will do it. So one of the things also to understand is once you give aspirin, it affects the platelets, and the platelet life is about 7 to 10 days. And because of that, once you give the aspirin, you've effectively made the platelet at that point unusable. The good news is we make platelets all the time, so again, it's not a big deal there. It takes about 10 minutes to onset, and it lasts around 2 to 4 hours. And again, for us in the AMI setting, this is actually a good thing. But one other thing, when you're administering this, make sure that your patient chews up the aspirin good. The faster that you can get it into the digestive tract, the faster it's going to absorb into the body, and the better the effects are going to be. No, we do not give it via IV form, but we'll talk about that here in a second. Again, we usually give this if we think that they're having cardiac-related chest pain. I want to stress that point, cardiac-related chest pain. If we think that they're having an MI, again, the benefit way outweighs the risk of this. It can be used for the reduction of fever as well. However, usually in the pre-hospital setting, we do not use it for that. Rheumatoid arthritis and osteoarthritis, it works very well for to help reduce the inflammations. And again, if they have signs and symptoms of cerebral vascular accident, again, if you know that it's a thrombolytic stroke, if it's not a thrombolytic stroke, if they're having a brain bleed, aspirin is not your drug. All right, so what are some of the big things that it causes as far as the biggest things that you get from an aspirin administration? The very low episodes of side effects. The biggest one is probably the ringing in the ears is the one that you're going to see a lot. You can get some confusion. People can have convulsions or dizziness because of taking aspirin. Again, thrombocytopenia, thrombo meaning clot-forming agent, cytocell, penia, low count of those, okay? Your gastrointestinal effects, though, this is where they can cause some problems. If they got any type of GI bleeding, nausea, vomiting, heartburn, stomach pain, you probably want to stay away from the aspirin, especially gastrointestinal bleeding, because remember, this is an anti-platelet drug. What stops the bleeding? Platelets. So you're really hurting yourself if they have any type of bleeding like that. The other thing is you can cause the heart to race just a little bit, and again the tinnitus, the ringing in the ears. Okay, yes, people do have anaphylactic reactions to aspirin? It is a possibility. So when do we not give aspirin? Absolutely. Kids under 12, it's an absolute no-no. If their patient is pregnant, we do have adverse effects on the fetus. If they have a hemophilia or other bleeding disorders, we don't want to do it. Severe asthma, it can trigger asthma attacks. We really don't want to use it in that case. Again, if they've had any type of recent surgery or recent gastrointestinal bleeding, we need to ask them about that, okay? If they have an allergic reaction to salicylates, we again, these are things that we would ask them before we give the drug. But definitely, the children under 12 is a no-no. You can have cases of Rye syndrome because of that. Again, if relative contraindications, if they've got ulcers, you got to be careful. Diabetes can raise blood sugar. Again, but usually in the case of an AMI, it's much better to give the drug than it is to not give it. Again, asthmatics, it can trigger an asthma attack. If you got an aortic dissection, a tearing type chest pain in the chest, probably not a good idea to give aspirin. The bad news will be they will bleed out faster. Again, we don't use anticoagulants usually with aspirin. Alcohol, we got to be careful with that because again, the blood thinning effects of that. And usually you can give administration with antacids that helps. It will reduce the amount of absorption. So if you give an antacid, remember acetylsalicylic acid. You're kind of fighting against yourself if you give a Rolade along with a dose of aspirin. So again, in larger doses, by the way, like I said, it depletes liver glycogens, so you got to really be careful. It does dump out. You can have a rebound hypoglycemia. And if the patient develops tinnitus, again, immediately, if you start getting the ringing in the ears, you need to discontinue the use. And then the administration of aspirin, with antacids, bad idea, just don't do it. Now, so how much do we give of this? So again, usually our adult dose is 81 to 325 chewable aspirin. So again, chew that aspirin up. Chew it up really good so that it absorbs faster. For other uses, not in EMS or home use, it can be given every 4 hours. This is for like your fevers or rheumatoid arthritis in cases like that. But again, usually EMS doesn't give it for that. We usually give it for cardiac-related chest pain. Pediatric dose, there's this long run. I'm going to give you the down and dirty of the pediatric dose. Don't give it to kids unless the doctor tells you how much to give, okay? And so, again, usually aspirin is not our drug, especially for fever reducing in children. I want to very much stress that. It is usually not that dose at all. And we can have, remember it was a contraindication, yes, it does have fetal effects, so don't use, if the patient's pregnant, stay away from the aspirin, okay? You really do need to stay away from it. All right, so that's a brief overview of aspirin, and we will see you guys on the next video.